Doctors, nurses, and healthcare workers are facing increasing levels of threats and violence, a long-standing problem that's gotten worse during the pandemic. That's the warning from the American Medical Association in a recent op-ed, which notes as many as 38% of healthcare workers face violence during their careers, and people in this field were 50% more likely to be harassed, threatened, or hurt during the COVID-19 pandemic. Joining us now are registered nurse Kristen Perez of the Illinois Nurses Association and Dr. Gerald Herman, president of the American Medical Association. Thanks to you both for joining us. Dr. Herman, let's start with you, please. You recently wrote that op-ed on this issue. How has this problem been exacerbated by the pandemic?
Good question. It was present before the pandemic. We were already noticing over the period between 2011 and 2018, as you notice in my op-ed, we already had like a 68% increase in violence against healthcare workers before we even had the COVID pandemic. We don't have all the data, but I can tell you we're seeing more and more violence almost daily in our healthcare environment against all types of healthcare workers, physicians, registered nurses, you name it. We're all getting a little more nervous about being assaulted, both physically and verbally, and threatened. So it is a pandemic of violence almost. It is very frustrating for us. We're just trying to do our jobs.
I'm sure. Nurse Kristen Perez, and as we just mentioned, it has not just been during the pandemic. Federal statistics show a 67% increase in injuries from 2011 to 2018, and that healthcare workers are 5 times more likely to face workplace violence. Would you say that tracks with what you've seen in your career?
Oh, definitely. Workplace violence in the healthcare setting is running rampant. It has always been a problem. I've been a nurse for about 11 years, and I can't say that I've experienced violence every day, but I can say that I've experienced it often. And that's ranging from like physical contact from a patient or family member being slapped. I've been bitten before, receiving verbal threats, and also sexual harassment.
Dr. Herman, you proposed several solutions, including better tracking of threats and violence against healthcare workers and better security procedures. Are these improvements, are they in the process of being made, or is healthcare lagging behind on this?
Well, I can't say they're in the process of being made. I think there are ways that we need to gather the data. The fact that we have data no more current right now than in 2018 bothers me a little bit. So I think we need to have better statistics. We're scientists, we're healthcare workers. We depend on the science to make adequate decisions. We've had to have science lead us through the pandemic response to COVID now. So we need some more data, more statistics so that we can take actionable steps to improve the healthcare safety for our healthcare workers, the workplace safety.
And Dr. Herman, any thoughts on causes of this increase and of the violence?
Well, I don't think people are deliberately trying to be violent in the COVID pandemic. There are a number of issues that are putting a lot of our patients in stress. Number one, we've had to restrict access because of the COVID pandemic, puts a lot of us, not only healthcare workers, but the patients and their families at risk of contracting this very contagious disease. So we've had to limit patient visitation. We've had to limit overnight stays in the hospital. So that puts us at some type of odds. And people are already stressed if they're going to get COVID. Are they going to survive it? We've told them how dangerous it is. Then we limit access to their loved ones. They're already kind of stressed. And so when you put that on top of them, they're really just, I wouldn't say they're acting out, but you can understand or be somewhat empathetic to their concerns. What we cannot allow is physical aggression and violence. So that we're just doing our jobs. Our healthcare workers, as you heard from Kristen here, we just need to do our jobs. And as Ms. Perez says, we need to be allowed to do it in a safe environment.
And Kristen Perez, what role do you think staffing shortages play in healthcare worker safety?
Staffing is a huge issue within all healthcare settings, and especially in an inpatient setting where a nurse may be taking care of upwards of 6 and 7 patients in some cases, that, it's completely untenable for the nurse, and it's completely putting those patients and their families at risk of having adverse events, which makes people angry. Or when people feel like they're not getting the care that they need and the care that they deserve, the patients and family members can become not only verbally aggressive towards you, which rightfully you can understand their feelings, but also physically aggressive. And I can tell you that I have a coworker out right now from my hospital who's been out since August, and he needs a second surgery after an injury he received in the ER from a violent patient. Wow. So when patients are not getting the care that they need and they're not getting their needs addressed in a timely manner, that can be solved with appropriate staffing, which hospital administrators are not doing. And currently we're working on passing state safe patient limits laws here in Illinois to hold hospitals accountable to make safe staffing a possibility and something that will protect patients and nurses.
And Dr. Harmon, you also note in your op-ed the racial component of some threats and attacks. Healthcare has a troubled history in this respect. The American Medical Association itself apologized some years ago for its history of discrimination. What can the healthcare field do to improve equity and protect people of color?
Well, in 2020, the AMA recognized increasing violence against healthcare workers as a public health threat. And then last year, House of Delegates recognized that racism is a public health threat as well. And so we really are already recognizing and putting formal steps in process. We have a health equity plan to address that we put forth this past summer. We also believe that these current acts of them, and some of them more recently, appear to be addressed with a racial component and or an ethnic component and the targets of some of these various neo-Nazi type groups. That's unacceptable. We need to address that and immediately take steps to prevent that against our healthcare workers. They don't deserve that. As you heard from Kristen, this is our job. We have to do it, and we have to be allowed to do it in a safe manner. We need to be there for the patients and for their families. We're trying our best to be part of the solution.
And before we run out of time, Kristen, on that note, what sort of toll do these threats and attacks take on healthcare workers, especially at a time when we know you all to be maxed out?
Yeah, definitely COVID is making us completely, on the edge and close to falling off the cliff in some ways, both physically and emotionally. And I can say that for myself and for so many of my coworkers that we are hanging on by a thread in so many ways. And an act of violence or a threat towards you, it could be the one thing that makes you walk away from your career as a nurse or from giving bedside patient care. And I've seen that all too much during this pandemic and prior to, of people walking away because of those reasons, because of the risk to their health and safety and it not being addressed appropriately by hospital administrators.
All right. And we thank you both for the work that you do. Best of luck to you, Nurse Kristen Perez and Dr. Gerald Harmon. Thanks for joining us.
Thank you.
Thank you.